Good morning, everybody.
Good morning. My name is Kayla David.
And I'm Sarah Kelly Palmer. Welcome to Be Well Live. If this is your first time joining us, Kayla and I come here every other Wednesday to talk about topics to support you during COVID-19. And it's our favorite thing to do, I think, Kayla, right? Every other week.
Yeah,
And
it
we
really is.
we work for Family Service of Rhode Island in the healing department. Family Service of Rhode Island offers a variety of services, including telehealth counseling. And we are here for you during this time. So we encourage you to reach out to us if you are in need of help.
Yeah, so we'll be joining together, as Sarah said, today and every other Wednesday at 10 a.m. for discussions that support wellness during COVID-19. And we're actually coming up on about a year, the year anniversary of us doing this show, but also of, more importantly, of COVID-19, the first cases in Rhode Island. So, as we're coming up on this year, it's still just as important, if not more important, as we're seeing kind of the cumulative effects of this year, to be informed, to understand how COVID-19 might be impacting not only our physical health, but our mental health. So please take a moment to share this with your friends, start a watch party, find us on YouTube or Facebook, and help us reach as many people as we can with this important information about being well during COVID-19. Now more than ever, it's important for us to reach out if we're struggling and to reach out to our loved ones and connect our loved ones with assistance if they're struggling. COVID-19 has put just a extraordinary amount of stress on all of us and on our community, and it impacts us in so many ways. It impacts our mental health, our overall well-being, our physical health, and our social and community health.
It has been a long road, Kayla. I can't believe it's been a year. So, we've all experienced this collectively. Lots of stressors, distance learning, quarantining, businesses closing, isolation from our friends and families, and for so many, the loss of loved ones.
Mhm.
Um, Many are really looking and hoping for an end to this pandemic and that idea of getting back to normal, right? Or what once was normal. So I'm really excited about our guest today and our topic, Kayla, because it really is helping to bring me hope. And I think it's a really hopeful topic.
Yeah, so today we're talking about the rollout of the COVID-19 vaccine. Many hope that this is the end, right? The end that's in sight. We're all kind of, I think, looking for something that's really hopeful. However, many are hesitant to get the vaccine or just don't know enough about it. So we have been getting a lot of questions about the
Mhm.
vaccine, and we hope that our guest today will be able to share information and dispel some myths that are out there about the COVID-19 vaccine. So today we are fortunate to welcome Dr. Philip Chan, Medical Director with the Department of Health, to answer your questions about the COVID-19 vaccine and rollout here in Rhode Island. Welcome, Dr. Chan.
Thank you for having me. Pleasure to be here.
So let's get kind of into this. We knew that this would be a popular discussion. So we reached out to viewers and asked what questions they had about the vaccine. And as you can imagine, we got many responses, many questions. So we've done our best to synthesize them. So we're going to dive right in. So many are concerned about the speed at which the vaccine was made available. Some find it too slow, some find it too fast. So what can you tell us about the vaccine that's currently out, and was the development rushed?
Yeah, so it's a great question. So there's two vaccines out authorized by the FDA. One is the Pfizer, one is the Moderna. These vaccines were developed in under a year. And I think what the question is partly getting at is that it generally takes 6 to 8 years for a vaccine to come to be approved and use in the community. And so there's been some concern that this has been rushed. But to me, this is really one of the things that happens when the entire scientific community gets together. It's really amazing what can happen. So it took a year. A year seems like a long time. It's hard to imagine that we're still we're only a year into this.
Mm-hmm.
But I do want to assure people that all the safety review processes have been in place. These trials started back in July. They've done the same sort of rigorous scientific trials. The FDA has reviewed it. The CDC has reviewed it. And I think one thing that we've all seen is that there's more attention that's been placed on this vaccine compared to anything else, frankly, and certainly any other vaccine in general. So I've been reassured. The safety data looks really good. We've given the vaccine now to millions of people. Millions and
Right.
millions of people now have been vaccinated, and there's nothing that's unusual or unexpected happening, et cetera. So I've been reassured, and I encourage people as they think about whether or not to get the vaccine, right? We live in the United States of America. No one's going to force you to get the vaccine,
Right.
stick it into your arm. But just make sure as you consider it, just make sure to rely on sort of the evidence, the data, the science, talk to a medical provider, your doctor. Please don't base your decisions on what you're seeing on Facebook or Instagram, because I think, as Kayla mentioned, there's a lot of misinformation out there.
Yeah.
For sure. Um, I think that with the vaccine now available in Rhode Island and the rollout is happening, a lot of people are eager to get it, right? I think that's the majority that we're hearing. Can you share where we are with the rollout here in Rhode Island and when people might receive their vaccines? And how will they know if they're eligible? What does that look like?
Yep. So all great questions. So we've gotten about a little bit over 246,000 doses. We've actually given out about 151,000 doses as well. So we are well in the way of getting this vaccine out. I think if people followed the news, we've been a little bit slower than we like, and I just want to throw that out there. We're working to improve the processes, and we're using testing as a model as well. So for people that are aware, Rhode Island has actually had one of the best testing programs in the entire country. We've tested more people per capita based on a rate than any other state in the country. So we're actually, as of today, as a matter of fact, we are rolling out an online portal system that people can go to sign up. It's vaccinateri.org. There's also a phone number. One thing that we're also very sensitive about is that people may not have access to technology. So there's a phone line people can schedule as well. The phone number, I'll just throw it out there, is 844-930-1779. And so what's going to happen is people can go online to this site or call and be scheduled at one of our mass vaccination sites, which are open now at Sauconasset, our Sauconasset site, or the Dunkin' Donuts Center in Providence. We are still prioritizing people 75 years of age and older. And we are looking to open it up to people 65 years of age and older in the short time frame. One of the reasons why we started with that higher age cutoff is, of course, that one of the things we've learned during this pandemic is that people who are older are just at much higher risk of dying. So we're really trying to prioritize keeping people, safe and not dying, frankly, which is why we did that. The other two reasons, the other two mechanisms that people can get vaccinated is through CVS and Walgreens. So through the main websites, through CVS and Walgreens, people can sign up in Rhode Island. And then the states, the cities and towns actually are getting a vaccine supply as well. So there's these three ways. For the cities and towns, people should check in with their local city-town website. But the cities and towns will be have some doses that they can distribute. So I do want to, again, let people know that supplies are still limited, but we're really, especially this week and next week, we're looking to really push out as much as we can.
Great. And so you said people can sign up on the website or call, and even if they're under the age of 65, do they just get that gives you all the information of how to get in touch with them? So everyone should sign up if they're interested in the vaccine.
Yes, correct.
Great. So Dr. Chan, what should people expect when they go to get the vaccine? Because I think that there's a lot of differences, right, from each person getting it, and then there's that I think people are nervous about what's to come, what they should expect when they go.
Yeah, so one thing that I've heard is that people are having good experiences. So when people do schedule an appointment, please show up at your scheduled time. The clinic is not going to run out of vaccines for you. You have that slot set just for you. Encouraging people to remember that they'll be getting the shot in their arm. So wear some clothes that are somewhat loose fitting that you can kind of roll up your sleeve if needed. And then we are asking people to stay at the vaccination sites for 15 to 30 minutes after you get vaccinated, just to make sure that you are doing okay with the vaccine. Again, this is just to be extra super safe. We do know, and have seen a couple allergic reactions due to the vaccine. Again, this is expected. It happens with other vaccines as well. It generally happens within the first 15 or 30 minutes of people being there. So that's why we're asking people to stay there. But again, that is the most serious thing that we have seen from vaccination. But just to emphasize that it's really occurring in a rare number of people. And so if you have concerns about that or think you're at risk for whatever reason, please check in with your doctor, physician, or medical provider.
Dr. Chan, kind of related to that, is there any advice about, we've had questions related to, should I take Benadryl before I get the vaccine? Should I take Tylenol? Because, I think people's anxiety about feeling sick afterwards is kind of playing into it. So is there any advice around that, or is that something you should just discuss with your doctor?
Yep, so it's a good question. So
Yeah.
I tend to be a little bit of a minimalist in medicine, meaning I don't really believe in people taking medicines unless they need. So
Yep.
in general, it's not recommended to take stuff before getting the vaccine. Obviously, if you start to feel really bad after getting it, yes, please do take
Got it.
Tylenol, etc. But in terms of an antihistamine, etc., that should be guided by your doctor, by your physician. I
Okay.
think one thing I'll note that you're sort of alluding to is that, the expected reactions to this vaccine, right, are people tend to get a sore arm. They tend to have body aches, fevers, chills, mild fevers and chills, and people kind of feel crummy for a day or two. And that's
Right.
expected. And in fact, we are seeing it happen at a fairly high rate, higher than other vaccines. And to me, that shows that the vaccine is working. It's not something bad happening to you. It actually shows that the vaccine is stimulating your immune system and you're producing these antibodies against the virus. So it's expected. It's actually a good thing. And so I would take the Tylenol if you need to, but also, some of this just has to run its course. It shouldn't last any longer than a day or two at the most.
Well, that kind of led to my next question, which was, what are the main side effects of the vaccine? But it actually is really helpful for me to hear, Dr. Chan, that idea of, if you are experiencing some body aches or fevers, that means your body's doing what it's supposed to do. I think we or at least for me, I end up interpreting it as there's something wrong here. But I think it's really helpful to hear from you that means our body's doing what it needs to with that vaccine. So aside from those kind of day or two of symptoms or arm ache, are there any other side effects of the vaccine, or are we seeing a lot of adverse reactions to the vaccine as it's rolled out statewide?
Yeah, we're not seeing any significant adverse reactions. The main reactions are the sore arm, the body aches, the fevers and chills, and people kind of feel crummy for a day or two. And again, that's expected. It's happening at a fairly high frequency, as I mentioned, so it's something people should expect. It's thought to happen a little bit worse after the second time when you get your booster shot, that second dose. Again, these are 2 doses, so you need one. You generally need a second one about 3 to 4 weeks after the first one. And then and I just want to emphasize this again, in a very small number of people, they can have an allergic reaction. And again, we're not seeing that often. I'm aware of 1 or 2 actually. There's been some recent reports through the CDC, through others, that shows out of millions and millions of doses, it's really just a handful happening. So very rare in general. And besides that, there's not anything weird or unexpected. There's nothing weird or unexpected that we've seen. So I just want to, again, reassure people that this vaccine appears to be really safe as well as effective.
That's great to hear. Dr. Chan, if someone has tested positive previously for COVID, right, they've had COVID already, or maybe they've been tested and the antibodies have shown up, do they have to wait to get the vaccine? And if so, how long? Does that play into it? Like if someone's just recovered from COVID, can they go out and get the vaccine right away?
Yeah, so great question. So people that have active COVID infection should not be vaccinated. But if you've recovered from COVID, the recommendation from the CDC is still to get it. You could wait, a few months, up to 90 days before deciding to get it. We are learning, and again, this is all still rapidly evolving. We still don't have all the answers, but we do know that when you have COVID infection initially, it does seem that you have some degree of immunity for the following 90 days or 3 months. But I want to, again, caution people that there's a little bit of a spectrum for that, meaning is that not everyone has a really robust immune response, even when they get infected with COVID. And we know, for example, if you have asymptomatic infection, and this should make sense, is that you may not develop as robust of an immune response as someone that got really sick with COVID. So I would just ask people to check in with their provider if there's any question, but the recommendations are not to be vaccinated if you have active COVID infection, but you can be vaccinated at any point after that.
Great. And so, Dr. Chan, I think there's lots of questions of who's paying for this, right? And we want to dispel any myths so that people are not avoiding, because I think a lot of times people avoid medical treatment when they are choosing between medical treatment, right, and basic needs. So who's paying for the vaccine? And will the public have to pay a copay or pay out of pocket, or is this, free to people right now?
So good question. So the COVID vaccines are being provided at no cost by the federal government, by the state government. People without health insurance can also get the vaccine at no cost. So providers, when you get the vaccine, they may charge your health insurance for giving you the shot, but they shouldn't charge you. So people are getting bills for the vaccine. Definitely bring them to our attention, either me personally or the Department of Health. But in general, that should not be happening, and the vaccination should be free to people.
Great.
And are there certain populations where COVID-19 vaccine is not indicated, or certain groups that should not get the vaccine that we know of?
Yeah, so it's a good question. So the only hard contraindication for this vaccine, the only real reason why you should not get it is you had an allergic reaction to the COVID-19 vaccine itself or one of the components. And so the components include polyethylene glycol, or PEG, PEG, or polysorbate. And so if you have an allergy to some of these things or known to, then you should not get it. If you have an allergy to anything else, so food, other drugs, pets, seasonal allergies, none of that is a reason not to get the vaccine. So you should still consider. There are a number of people out there who may be allergic to multiple things. I would say if you have a lot of allergies, then you should check in with your provider or a physician, et cetera, or an allergist as well to discuss some of that. But none of that is a contraindication for getting this vaccine. Only if you're allergic to the actual COVID vaccine itself or something in it.
Got it. I think another big question we get a lot is pregnant or breastfeeding moms, right? So moms to be, or those that are breastfeeding, are there any recommendations around that population around getting the vaccine?
That's a great question.
Yeah.
So there's a lot of major OB/GYN organizations that have come out to say that the vaccine appears to be safe. I think the one limitation that I'll just throw out there is that there is limited data in people that are pregnant who get the vaccine and people who are lactating. So that has to be kept in mind. There's no biological reason to think about how this vaccine would actually harm a developing fetus, but it is definitely a concern and consideration. And so based on that, it's really a personal decision. And so what I would recommend people to do would be to chat with their physician, their provider, their OB. Part of it depends on if you are at risk of getting COVID-19 during pregnancy. I think one thing that we do know is that if you do get COVID-19 during pregnancy, you can have some really adverse outcomes. So this to me is really a risk versus benefit situation. Like how much at risk are you really at COVID-19? If you sit at home all day and don't really go out and aren't really at risk of COVID, you may decide to forego the vaccine if you're pregnant. If you're a healthcare worker who's pregnant, that's a totally different story. And I would argue that you should probably get it after discussion with your provider. So it really comes down to a personal decision. There's limited data. It does appear to be safe, and part of it depends how at risk you are really for COVID as well.
So, Dr. Chan, we've started to hear things around herd immunity, which is like a new term for me. I'm sure not a new term for you, but what do we know about the idea of herd immunity, and how do we get there as a state or as a nation? Is that something we're even thinking about right now, or are we just kind of in earlier phases?
Yeah, phenomenal question. So herd immunity, again, it's talking about the percentage of the population that really has to be immune to any virus, in this case COVID, in order to prevent transmission in the community, right? Because if you have enough people that are immune, then the virus simply can't spread because it's just going to run into people that are already immune. And so the two considerations for herd immunity are, one is people who have been infected, right? People who have been previously infected have some
Mhm.
degree of immunity. And then, of course, people that are vaccinated. So it's additive when you talk about herd immunity between those two groups. It's generally thought that you need about 50 at the very barest minimum, between 50 and 60% of the population has to be immune in order to see some herd immunity impact. And then the higher the better. And if you listen to people like Anthony Fauci, he'll often say 80 to 90% is optimal. So, given that we anticipate that over 20% of the population has already been infected and should have some degree of immunity, we're working our way to achieve herd immunity, of course, through vaccination efforts and getting there. So the way that we get there is by as many people as possible getting vaccinated. And I think that's a key point too, right? I'm
Mhm.
42 years of age. I'm otherwise healthy. I don't have any medical problems. And so I'm, you know, being the fact that I'm a little bit older, I may be a little bit higher risk for COVID. But even if I were to get COVID, which I haven't had, I would probably do fine. And so one of the reasons why, I would get vaccinated would be to protect others in my household,
Right.
protect, my parents who are, 68, 69 years of age. Obviously, they're in a higher risk group, and to protect others around me. So I do think it's important for people to consider the vaccine. Even if they themselves aren't at much higher risk for it, they should still consider, because obviously all of us want to end this pandemic as soon as we can.
Yeah, I love that you're highlighting that, Dr. Chan, that getting the vaccine really can be, right, a step in that direction, something that we can all do. So thank you for highlighting that. Once you get the vaccine, how long we expect it to last? Is this something like the flu shot, which it'll be recommended that we get every year? Or what do we think about
Yeah,
that?
so good question. So again, so much of this is still new. These vaccines have just been, recently reviewed by the FDA, CDC. I don't think we know for sure. I think if I had to throw a ballpark out there, I would probably say years. I think the one sort of challenge and unknown is all these variants. And big question, the $1 million question is, probably more than $1 million question
Mhm.
is whether or not we're going to see a variant that overcomes the vaccines. And so the good news so far is that the vaccines, most of the vaccines, the Moderna, the Pfizer for sure, appear to have activity against all the variants, at least some degree of activity. So it's not just a yes or no. There's a lot of sort of in between. So the
Right.
current vaccines do appear to be effective even against the emerging variants. So that's good news. So I'm going to be optimistic that it's going to last at least for a couple years, if not longer. And I'm hoping that, given that we're going to mass vaccinate, theoretically the entire world over the next year or two, is that should really hopefully end this pandemic once and for all. I will say on another note too, even if it turns out that some of these strains emerge which overcome the vaccines, these vaccines can be easily tweaked to
Okay.
address other strains of this virus. So I think that's really reassuring. And if you look through the news, you'll see that companies like Moderna are already working on updating their vaccines to address some of these variants. So all good news in general. I think we're working through it. There are some bumps in the road, as there always are, but I am optimistic that we'll get there, and this vaccine will be effective at least for the intermediate years to come.
Yeah. So, Dr. Chan, could have my final question, anyways. Sarah might have some questions, but I think the vaccine is being kind of touted as this like way to get back to normal, and it does sound like maybe over time that's the case. But what are the recommendations for those who have been vaccinated? So as we're getting to like many people getting the first few people getting to their second dose, what are we recommending in terms of social distancing, safety guidelines? Like once you get vaccinated, what does that mean for people?
Yeah, good question. So again, when we talk about these vaccines being 94, 95% effective, they're really effective in preventing severe disease and from people ending up in the hospital. One of the things that we don't know quite as much about is whether or not these vaccines can prevent people from being infected and having like asymptomatic infection and being
Right.
transmitted to other people. There's some emerging data that's been coming out that shows that yes, that is the case, and that's sort of what we expect. but we don't know how likely that is at the moment. So we should know more over the next month or two. There's a lot of studies and other data being collected. But at this time, even if you've had the vaccine, we're still asking people to be careful, meaning still physically distance as much as they can, still mask when they're out in public, and still adhere to sort of the guidelines that we are recommending as a state. So again, it's to be safe. There's still a chance that you may have asymptomatic infection. We've definitely seen a couple cases, and you'll hear about them in the news too, that people can still have very mild or asymptomatic infection even once they've been vaccinated. So we're asking people to just be careful still, even if vaccinated, to protect other people that are not yet vaccinated. And hopefully over the next couple months, that will change, of course, but asking people to still be careful for now.
Great.
That's great advice. So we got a lot of questions. I'm just going to throw out one or two more, Dr. Chan, if that's okay, from that are kind of more specific from some of our viewers. One is, does Rhode Island allow a caregiver of an elderly person to receive the vaccine when the elder gets it? Or are we not there yet?
So we're not quite there yet. I know that Massachusetts just started doing that. It's something that we're looking at. But again, we are working to prioritize those older age groups, but we're looking at the caregiver issue closely.
Great. And then one more specific question. For those who are 75 and up or 65 and up who have autoimmune disease, will they get priority over others in that group, or are we just kind of approaching it by age? Like, is there any prioritization within those age groups?
Yep, good question. So within a next couple weeks, we will start to prioritize people with other underlying health conditions as well.
Okay.
So we are going to prioritize them, people with autoimmune diseases who are immunocompromised, lung disease, heart disease, kidney disease, et cetera. So yes, we are going to prioritize health conditions early on as well.
Okay.
So, Dr. Chan, we want to thank you so much for joining us today. Final question. This one should be an easy one. If people have more questions about the vaccine, we're being told don't go to Facebook, don't go to Instagram. Where should people go if they have questions, or to ensure that they're getting accurate information about the vaccine and about the COVID-19 pandemic?
Yep, so great question. So I would refer people to the CDC website, actually. So the CDC has really spent an enormous amount of time putting together tons of web pages related to the pandemic, both that are based on data, they're regularly updated. So I would say for the majority of your questions that may come up, please do put CDC in that search line with your question, and that should pull up some of the CDC pages. For more local information, definitely check the Rhode Island Department of Health website. I think other scientific websites, the World Health Organization also has a robust amount of data, obviously focused on across the world. And then sites dedicated to science, some more reputable news sources, some of the mainstream news sources tend to have some really good stuff that I've seen online. So I would stay away from anything that's on the fringe, anything that may be less than reliable.
Great.
Well, we are so grateful for you coming on here. So again, thank you for joining us, and also for your colleagues at the Department of Health and all your hard work. I mean, I just envision that none of you are sleeping, which I hope you are. But I know that everyone at the Department of Health has really kind of done everything they can to ensure that Rhode Islanders are safe, and we're mitigating some of the worst impact of this pandemic. So thank you. Thank you for coming on today, and thank you for your team. And for our viewers, we look forward to seeing you in 2 Wednesdays, where we share more information on ways to cope during COVID-19. And please remember, if you or a loved one is struggling during this time, please reach out. Now more than ever, it's important for us to be paying attention not only to our physical health, but our emotional health as well. And we are here to help, as well as all the information on the Department of Health. So thank you.
Thank you, Dr. Chan.
Be well and be safe.
Bye.
And thank you all for the frontline work from Family Services.
Oh, thank you.
Thank you all.
Thank you.